Hey everyone, welcome back for another deep dive. Today we're going to be looking at OptiLight, which is this intense pulse light therapy that's really making some waves in dry eye management. You guys sent in a guide on OptiLight, so we're going to break that down and give you the need-to-know info on this exciting treatment.
Yeah, we're going to be covering everything from the hardcore science to some really practical tips you can use in your practice right away. Think of it as like your OptiLight cheat sheet.
I like that. I like that cheat sheet. Now, we all know as eye doctors that dry eye disease is just a real bummer for our patients. But before we jump into how OptiLight can tackle that, let's just do a really quick recap on what causes this multifaceted condition.
Absolutely. And the guide really emphasizes that understanding the underlying causes is key to proper management. And it's not always a simple tearjerker.
Oh my gosh, okay, that was so bad, I admit it.
Mhm.
But you are right, dry eye can be pretty complex. So let's start with the big kahuna, the most common culprit, meibomian gland dysfunction, or MGD for short.
Yeah, and the guide actually highlights that as the leading cause of evaporative dry eye, affecting something like 86% of dry eye patients. So as a reminder, those little meibomian glands in the eyelids, they're responsible for that oily layer of the tear film, the mebum.
Right. So when those glands get clogged or they're inflamed, it's like trying to spread cold butter on toast. You get a patchy tear film that breaks up really fast and evaporates way too quickly, and that leaves your eyes feeling all dry and irritated.
Exactly. And it's not just the glands themselves. The guide goes into some other factors like aqueous deficiency, where you just don't have enough tear production, which can be linked to autoimmune conditions like Sjogren's, where your body is attacking those tear glands.
Oh, wow. So it's like a tear factory that shut down production. It's a major bummer.
Ah.
And speaking of inflammation, the guide also points to ocular rosacea as another key player in dry eye.
Yeah, and those telangiectasias, those little blood vessels that we see around the eyes in rosacea, they're not just a cosmetic thing. They can actually contribute to MGD by releasing inflammatory molecules that cause even more havoc in those poor little meibomian glands.
Wow, it's like a vicious cycle of inflammation.
Yeah.
And we can't forget about our little friends, the Demodex mites. Those guys love to hang out in the hair follicles, even those on the eyelids.
Yeah.
And the guide points out that they can trigger both rosacea and MGD, just further complicating things.
It's like a microscopic party on your eyelids, and no one's invited. And of course, we can't forget about just mechanical issues like changes in the eyelids due to age, or just plain old incomplete blinking, all of which can really impact meibum secretion and contribute to dry eye.
Wow, it's amazing how many things can cause dry eye. It's like it's not just dry eyes, it's a whole cascade of issues.
It really is a whole ecosystem of issues, and that's where this OptiLight comes in. It's not just trying to mask the symptoms, it's really trying to get at those root causes.
Okay, so we've laid the groundwork for this dry eye landscape. Let's shine a light now on OptiLight itself. What exactly is it, and how does it work? It's magic.
So intense pulse light, or IPL, have actually been used in dermatology for ages to treat conditions like rosacea and unwanted hair.
Mm.
But its use in dry eye was kind of a happy accident. Dermatologists were treating their patients with IPL for those other conditions and noticed, hey, their dry eye symptoms were getting better.
Oh, that's pretty cool. Those aha moments in medicine are always so fascinating.
Huh.
But I gotta ask, how does shining light on the skin help with dry eye?
So think of it like a really targeted energy boost for those tired meibomian glands. OptiLight uses very precise pulses of light that get absorbed by certain targets in the scare, like melanin and hemoglobin. And that absorption actually generates heat, which then leads to a whole cascade of beneficial effects.
Okay, so it's not just random light, it's tuned to specifically trigger certain effects. What makes OptiLight unique compared to other IPL devices?
Well, OptiLight is actually FDA approved specifically for the management of dry eye disease due to MGD, which is a huge win for us eye care professionals. And the guide points out some really cool features like the optimal pulse technology, which helps deliver those really precise bursts of energy. And there's also the Sapphire Cool technology that makes it way more comfortable for the patient.
That sounds pretty high-tech and pretty patient-friendly. So how does this light energy actually lead to relief for our dry eye patients?
That's where the multifaceted magic of OptiLight really comes in. It's tackling those root causes that we talked about through a bunch of different mechanisms.
Let's break those down one by one. Starting with photobiomodulation. That one always sounds so intriguing.
It is, and it's really just a fancy way of saying that light can stimulate cellular activity.
Yeah.
You can think about those meibomian glands, like tiny little factories pumping out the good stuff, the mebum. And photobiomodulation is like giving them a jump start. It might even help boost the production of the cells that make mebum the mebocytes.
So it's not just melting the existing meibum, it could help regenerate those glands themselves.
That is super cool. What about the inflammation we talked about earlier? Does OptiLight do anything for that?
It does. OptiLight actually targets those telangiectatic blood vessels and helps reduce the production of inflammatory molecules. It's like
Hmm.
turning down the volume on that whole inflammatory response.
Mhm.
So those meibomian glands can finally get a break and function the way they're supposed to.
So a two-pronged attack, boosting myelin production and calming down the inflammatory storm at the same time. What else is OptiLight going after?
Well, remember those Demodex mites we talked about?
Hmm.
Well, turns out OptiLight can help reduce their numbers too. It's not totally clear how, but it's probably a combo of the heat and light actually damaging those little mites.
Wow, so it's like this multi-tool against dry eye. It's going after clogged glands, inflammation, and even those pesky mites. It almost sounds too good to be true.
It really does hold a lot of promise,
Mm-hmm.
but like any treatment, it's crucial that we pick the right patients and make sure we manage their expectations. I can see that. Not everyone's going to be a perfect candidate for OptiLight.
Right. The guide really emphasizes that we need to do a really thorough dry eye evaluation before we even consider OptiLight. We need to know what's going on with that patient's specific issues, how bad their dry eye is, and if they have any underlying health conditions.
So it's like being a dry eye detective. We got to gather all the clues before we decide if OptiLight is the right weapon to use. Speaking of weapons, are there any contraindications we need to be aware of?
Absolutely. Skin pigmentation is a big one. Remember, OptiLight works by targeting pigment. So people with darker skin tones, especially those with Fitzpatrick skin types 5 and 6, have a higher chance of getting burns or having changes in their pigmentation.
Okay, so extra caution with those patients. What about things like tattoos, recent surgeries, or certain medications?
Yeah, all of those things can come into play. The guide has a whole list of contraindications and precautions, so it's definitely worth a good read.
Makes sense. It's always better to be safe than sorry and check everything out before we start zapping anyone with light. Which brings us to our next step, educating our patients.
Oh, yeah. Before we even think about doing any treatment, we have to make sure our patients understand what OptiLight is, how it works, and what they can expect.
Absolutely clear communication is key. We need to manage their expectations and let them know that while OptiLight can be super effective, it's not going to cure their dry eye overnight. It's going to take a series of treatments and even some ongoing maintenance to get the best results.
It's definitely a partnership between the doctor and the patient working together to beat dry eye.
And that open communication should continue throughout the treatment itself. We want to make sure our patients are comfortable and informed the whole way through.
Right. So let's talk about what a typical OptiLight treatment looks like. What can our listeners expect on the day of the treatment?
Yeah, what's the step-by-step?
Well, first of all, patient comfort is super important. The guide recommends using a cooling gel to help, and we got to make sure their eyes are protected with those adhesive patches and goggles.
Safety first, for sure. But what about the actual light application? How do we target those specific areas?
So the guide usually recommends starting from one ear and then moving across the cheeks and the nose under the eyes all the way over to the other ear. We use light pressure just to make sure we have good contact with the skin, but we don't want to push so hard that the blood vessels blanch. Remember, those are our targets.
So it's kind of a delicate balance, finding the right amount of pressure. It sounds like an art form.
There's definitely a learning curve, but like anything, practice makes perfect. Now, the guide also talks about this whole debate about whether we should do manual gland expression after the treatment.
Oh yeah, the great expression debate. Some people are all about it, others say skip it. What's your take on all that?
Well, it's a topic that deserves its own deep dive. But the guide does a good job presenting both sides so you can make the best decision for you and your patients.
I like that. So we've talked about picking the right patients, prepping them for treatment, the actual light application, and that expression debate. What about aftercare? What do patients need to know once they leave our office?
Aftercare is pretty simple. Sun protection is a must, especially in the days after the treatment. And we want to encourage our patients to keep up with any other dry eye treatments they were doing before OptiLight. It's often a multi-pronged approach.
So we're not ditching our entire dry eye toolbox.
Right. It's all about finding the best combination of treatments that works for each patient.
So speaking of management, how many treatments does a patient usually need, and how often should they be coming back?
That's a great question, and one that we're going to dig into more in the next part of our deep dive. We'll be talking about treatment protocols, follow-up, and how to set realistic expectations for both you and your patients.
Sounds like a plan. And for our listeners who can't wait to learn more, we've included a link to the full OptiLight guide in the episode description. If you're finding this deep dive helpful so far, hit that follow button and leave us a 5-star rating.
We'll be back soon to continue our OptiLight exploration. Until then, keep those meibomian glands flowing.
Welcome back to our deep dive on OptiLight. Last time we talked about, the basics of dry eye and how OptiLight works. But now let's get into the nitty-gritty. and talk about like treatment protocols and what kind of results we can expect for our patients.
Yeah, taking all that scientific knowledge and actually putting it into practice in our clinics, the guide actually gives us a pretty good framework for how to do that.
Awesome. So let's talk protocols. How many OptiLight sessions does a patient usually need before we start to see, those good results?
So the guide recommends starting with an initial series of 4 treatments, and these treatments are usually spaced out about 3 to 4 weeks apart. Think of it like a strategic plan, giving those meibomian glands a chance to recover and regenerate between those sessions.
Makes sense. It's not a quick fix. It's a journey to get those eyes healthy. But why 4 sessions? Is there like a magic number thing going on here?
Well, the guide mentions that this 4 treatment protocol is based on a ton of clinical experience and research that's shown that this approach just tends to work really well. You get those cumulative benefits with each session kind of building on the last.
So it's like a gym workout for the meibomian glands, slowly strengthening and improving their function over time.
Okay, so what happens after those initial 4 treatments? Is that it, or do patients need like maintenance sessions?
That's a really important point. OptiLight isn't a cure for dry eye. It's more about long-term management. So once that initial series is done, most patients will benefit from getting maintenance treatments, maybe 1 or 2 sessions a year, just to keep those meibomian glands happy and healthy.
So like going to the dentist for regular checkups and cleanings,
Yeah.
trying to prevent those dry eye flare-ups before they even happen. So let's talk results. What kind of improvements can we realistically expect for our patients after OptiLight therapy? Well, the guide actually cites a bunch of studies that show significant improvements in both the signs and the symptoms of dry eye. Patients often report less dryness, less burning and grittiness, and even some people say their vision is clearer.
Now that's something we love to hear, and more importantly, our patients love to feel. But it's not just about how the patient feels, right?
Yeah.
We have to look at those objective measures too as, dry eye detectives.
Absolutely. We need that hard evidence to back up what our patients are telling us. And the studies have shown some pretty cool things like improvements in tear breakup time, which means a more stable tear film.
Yeah.
And we also see less corneal staining, which tells us that the ocular surface is healthier.
So positive changes in both how the patient feels and in those measurable signs of eye health. That's pretty convincing stuff. But let's break it down even more. What about those specific dry eye culprits we talked about? Does OptiLight make a difference when it comes to MGD inflammation and those little Demodex mites?
Yeah, the guide actually presents some really good evidence that OptiLight can help with all of those things. Remember meibography, that special imaging technique that lets us see the meibomian glands? Well, it's shown that after OptiLight, those glands actually look better and they function better too.
So we're actually seeing those clogged glands open up and start producing healthier meibum.
Wow.
That's amazing. What about the inflammation? Any changes there?
Definitely, studies have shown a decrease in inflammatory markers in the tears after OptiLight. So it looks like it's actually calming down that whole inflammatory cascade we talked about.
So it's not just masking the symptoms, it's going after the root of the problem, which is great for our patients. And how about those Demodex mites? Are they packing their bags after OptiLight?
Well, we need more research to really understand how this works, but studies have shown a reduction in Demodex mite populations after OptiLight. It's probably a combination of the heat and the light that just makes it really uncomfortable for those little guys.
So it's like this triple threat against dry eye. It's tackling the clogged glands, the inflammation, and even those pesky mites, all at the same time. This OptiLight sounds pretty impressive, so I'm curious, how can we best integrate this into our practice? What are some practical tips for our listeners who want to start offering this to their patients?
That's a great question. And the guide has some really good advice on things like scheduling, staffing, and even marketing your OptiLight services. One thing they suggest is creating specific OptiLight days to streamline your workflow and make things more efficient.
I like that idea. It's like setting up an assembly line for dry eye relief.
Yeah.
And what about pricing and reimbursement? Those are always important factors to consider.
You're right. The guide talks about a few different pricing models. Like you could bundle OptiLight with other dry eye services or offer package deals for that initial series and the maintenance treatments. It also goes into the whole reimbursement thing and gives you some pointers on coding and billing to make sure you're getting paid for your services.
It's like a mini business course for dry eye management. Our listeners are going to love those tips.
Yeah.
We can't forget about continuing education and staying up to date on all the latest advancements in OptiLight therapy.
Absolutely. The field is constantly changing, and we have to be lifelong learners. The guide actually encourages us to connect with other eye care professionals, go to conferences, and participate in online forums and discussion groups to share knowledge and best practices.
It's like a support group for dry eye specialists. We can learn from each other and really push the boundaries of dry eye management. Before we wrap up this part of our deep dive, I just want to remind everyone that we have a link to the full OptiLight guide in the episode description. Make sure to check it out for even more details.
And if you're enjoying our deep dive so far, please hit that follow button and leave us a 5-star rating. We'll be back soon to wrap up our exploration of OptiLight. Stay tuned.
And we are back for the final part of our deep dive into all things OptiLight. It's been a really interesting discussion so far, learning about how it works and how to use it in our practices.
Yeah, we've gone from, understanding how complex dry eye really is to seeing how this OptiLight can really address those root causes.
It really has been a journey.
Yeah.
But before we wrap things up, I wanted to touch on something you mentioned earlier about the importance of staying up to date, keeping up with all the latest advancements in dry eye management.
Oh, absolutely. Dry eye research is always moving forward. There are always new treatments popping up and new things to learn. OptiLight is a fantastic tool, but it's not the only tool.
Right. It's like having one of those Swiss Army knives for dry eye. We need to know which tool to use and when. So how can our listeners stay informed about all the new stuff and make sure they're giving their patients, the best possible care?
Well, I always recommend going to conferences and workshops that are specifically about dry eye disease. It's a great way to hear from the experts, see new technologies demonstrated live, and you get to connect with other eye care professionals who are really passionate about dry eye.
Yeah, it's like a brainstorming session for dry eye specialists, sharing ideas and learning from each other. What about online resources? There's so much information out there these days.
Oh, for sure. Online forums and discussion groups can be really helpful. You can connect with other people in the dry eye community, share tough cases, and, even get feedback from colleagues all over the world.
It's like having a 247 dry eye consultant in your pocket. But with so much information available, it can be hard to know where to focus. What advice would you give our listeners on how to navigate all of this?
Be picky. Not all information is the same. Look for reputable sources like peer-reviewed journals, professional organizations, and those thought leaders who are really respected in the field.
Makes sense. We got to be smart about the information we consume and figure out what's really valuable. And I think that's a great takeaway message for today. Dry eye is a field that's constantly evolving, and we as eye care professionals, we have a responsibility to stay informed. Learn about new technologies and always be looking for ways to improve the lives of our patients.
Well said. I think it's really exciting to be a part of this field that's always growing and changing.
I agree. So we've reached the end of our deep dive into OptiLight. Hopefully everyone found it informative and helpful for their practice.
It's been great talking about this with you.
And for our listeners, don't forget we've got that link to the full OptiLight guide in the episode description. Go check it out for all the details. And if you enjoyed this deep dive, hit that follow button and leave us a 5-star rating. We'll be back soon with another deep dive into something new in the world of eye care. Until then, keep those meibomian glands flowing.